It's kind of always been part of what we do in the ER. We deal with some irritable people. But in the last 15 years, there's been a change in the way that that patients and family members react. And there's been an increase in violence against staff. I had a patient that was brought in by the police department. They were transported by 5 officers because there was such a concern for officer safety. And the plan was they were going to be left in our department to be cared for by healthcare workers. And that is the legal plan in those cases, that this patient who was so unsafe they had to be transported by 5 police officers would just be left in the care of nurses and doctors. When someone shows up, especially for a mental health evaluation, we ask that they leave their belongings with us for their safety. And they initially refused, and almost immediately, within 30 seconds, the patient escalated, and they punched me in the face, just like that. And I was knocked unconscious. There was a security officer just outside the room, one of our staff, who tried to step in. He was also punched in the head and was knocked unconscious. That patient was eventually brought to prison for that evening, to jail, and lodged, but that involved waking up a judge. It involved a conversation between an attending physician, psychiatry. That process was so different, so non-standard, that it took what felt like an act of Congress. It is common for our staff to be injured by a patient or a family member, and for that assailant to be given a ticket and then police to leave the scene, because those are not lodgeable complaints, even with injury. That type of burden on an individual, on a family, on a department, on a community of healthcare workers is more than you can reasonably ask. Giving our law enforcement officers the opportunity to use their judgment, to use S36, to remove those patients, those family members that are a direct threat to staff, to other patients, family members, and to their community, is a tool that we need to keep our staff and our communities safe.